Welcome to another episode of the Less Invasive Podcast. I'm your host, Lucien Blondel, and I bring 20 years of experience in surgical robotics for neurosurgery, orthopedics, spine surgery, interventional radiology, and now interventional oncology. So today I have the pleasure to have Eric Anderson on the show. Eric Anderson is the founder of Extremity Surgical, and so we'll be talking about extremity surgery, medical sales, and more. Hi, Eric. How are you?
Great, Lucian. How are you today? Thank you so much for having me on.
Yeah, it's a pleasure. So we've been knowing each other through LinkedIn. I've seen all the content that you are creating and sharing on this platform around your products and the fun videos with the drone and all that stuff that's going on in Florida where you're based. And so first, maybe I want to start with know a little bit about your background, your journey in this space, and how you ended up to the position you are today.
Sure. So I've been in the orthopedic space for well over 20 years now. Started my career with Synthes way back in the day as a trauma representative and held different positions throughout my career in sales management um, and different positions of that, all based in orthopedics. Quite a bit of experience in the trauma space, Smith and Nephew, um, Zimmer, Synthes, and then also uh, spent some time in the arthroplasty space with shoulders with um, Tournier, which is now Wright, which is now Stryker. So
Yeah.
there you go with that. Um, I'm sure we'll talk about that during our podcast. All the different companies are now a different name, but so that's where I and founded Extremity Surgical almost 3 years ago now, and along with Extremity Surgical, Ortho Idea, and kind of in conjunction, founded both of those companies in order to one sell extremity products to the marketplace here in the Southeast, and then two also Ortho Idea, which is you talk about my drone and some of the things that I do. I with Ortho Idea is a platform, is a podcast platform, video platform, as well as a print platform for um, marketing and just the arm that we use in order to share with the world about what we're doing in the extremity space. So, in a nutshell, that's Eric Anderson, how we got to where we are now.
Yeah, thanks. So you've been in the orthopedic space for, as you say, 20 years, and you started in extremities. Why did you choose to stay in extremities, and you didn't move to large joints or other areas in orthopedics? You are very focused on the extremities, I feel.
So when I left and call it quote unquote corporate America, I did a lot of studying on where we wanted to go as an organization. And still, it holds true to this point in time. Extremities was the fastest growing segment by far and double digits. And that seemed to be and still holds true where a lot of the innovation is coming to the marketplace. And so we decided that would be the best place to start. We talked to several companies, new technologies that were coming to the marketplace, and we decided, okay, that's where we're going to be as in extremities, hence Extremity Surgical, and that has played out. It's a it's a booming segment within orthopedics, and it's been an interesting ride the last few years watching these new companies, new innovation, and new technology come to the marketplace.
All right, thanks. So that's helpful to understand those dynamics in this extremity segment, and I'm not sure everybody is aware of that because there is a lot of buzz around the knees, the hips, and I mean there are other parts of the bodies that require replacement or other procedures. So maybe we'll jump into this topic and what kind of to start with, what kind of pathologies the surgeon face when they are doing extremity surgery. I know that, like in spine, it's deformities, degenerative trauma, tumors. Is it the same in extremities, and is there a different ratio than in other specialties?
That's a great question. So, to take the first part of that, extremities, there's it's twofold. One being the fracture side of it, the trauma side of it, and there's quite a bit of fracture work that occurs in whether it be hands, wrists, foot, and ankle, and that is a majority of what we see. Also, in that there is the arthritic component where you're seeing, especially in the foot and ankle world, you're seeing just because of arthritic changes, diabetic, which we is a I don't know if I want to use the word epidemic since the last few years, but an epidemic with diabetic patients in the United States that we're experiencing, and so there's a lot of that in the foot and ankle space, extremity space. There is a lot of focus on implants that can address those issues. Anything from plates and screws that are fusion based to total ankles, and then as we move on to intermedullary nails for fusion, and then also as well as we start moving into custom implants that are coming to the forefront, which is an exciting new uh, vertical within extremities that's occurring actually as we speak.
So how does it work if I'm a surgeon in Southeast in Florida in the US? Do I do like am I specialized in foot? I mean upper extremities or lower extremities, or do I do everything from foot, ankle, elbow, wrist, shoulder? Uh, how does it work?
Great question. So about 10 years ago, you did everything. Maybe more, maybe 10 to 15 years ago, you did everything from top to bottom. And those surgeons still exist, and they do, everything from a distal radius fracture to an ankle fracture to a a total ankle. What has happened in the US is now just with fellowship training, we now have quite a bit of upper extremity only surgeons that are focused because of fellowship training, as well as foot and ankle focused surgeons. And so there is now in most towns, and in at least in the southeast, you will have in larger metro areas. I'm going to say over 100,000 people. You will have upper extremity specific surgeons as well as lower extremity foot and ankle surgeons. And this is becoming more and more, and obviously because of the pathology that's happening with our patient population, that they are going, obviously as they get older, they're going to be needing having different issues that they need to have addressed, but it is becoming segmented for sure.
All right, so we see the same trend, I think, in other specialties where the surgeon tends to be the specialist in their specialty, and I understand that the same in the upper and lower extremities. So, how is the minimally invasive approach being used today in this kind of procedures? Is it the standard of care, or is it something that people are trying to do the most they can? How much of minimally invasive are these procedures?
So the minimally invasive aspect of the procedures has really just started in the last few years. Now, there was in the fracture world, there was minimally invasive um, aspects to it where they would, utilize some submuscular sliding the plate under and then making stab incisions in order to uh, affix the plate to the bone. So that's always been going on. But now in the MIS world, there is, as far as bunion corrections and things of that nature, it is becoming, um, the movement is on, I would say. A company like Novastep, who is actually a French company as well, they've addressed it with picoplasty. I know Arthrex has done the same thing with their minimally invasive procedures, and that's the wave of the future for sure. And I'm sure you see that in other specialties as well. But that's what's going. But it's come later than other specialties to the extremity space.
Is it because the incision is already I would say small? Like when we look at knee replacement, when you do open surgery, it could be a very large incision, and minimally invasive approach enable to really reduce the incision. In extremities, is the incision already small enough to perform the surgery without damaging too much of the tissue, the muscles, and stuff like that, or is there maybe not such a strong need for minimally invasive?
Twofold. I think that it so most surgeons from years ago received AO training, and AO training would tell you from the get go that you open it wide open, you visualize the fracture,
Yeah.
and you go ahead and do your work and plate it, and for the most part it worked fine in most places. But as it changed, the minimally invasive different plates and screws that came out, that's when surgeons started to study. So what's happened is um, companies have addressed this with different type of procedural type systems, and this is very new to extremities. So it hadn't been out, and this is specifically mostly talking about the in fracture world or deformity correction. That's what they've used it more as far as that goes. So I think it's been twofold. I think it's been their training originally, which was let's open it up and take a look and go from there, to now companies addressing it and surgeons also with technology saying, listen, we need to be able to do this. Instead of making this huge incision, let's make 2 stab incisions and get the same thing, and obviously foster a better healing environment.
Yeah, so what I understand is that this change has to come from both the surgeons and the industry, as the industry has to provide new products that have been specifically designed for a minimally invasive approach. And I hear that this is the case, and this is where it starts to be used more and more in extremity surgery. So we know that when we perform an open surgery, it's quite comfortable in the way that you see everything, and when you transition to minimally invasive, then you lose some kind of information on the anatomy, on where are your instruments, what kind of intraoperative guidance technology do they use. Is it fluoroscopy imaging, or is there more than this x-ray to understand where is the anatomy, and where are the instruments and implants?
At this point in time, it's under fluoroscopy. At this point in time, will that change? I believe it will. I think you're going to start to see technologies that come down the pipe that are involving, maybe different camera options. But as of right now, it's just fluoroscopy, and that's where we'll see where it goes. But I think that that's going to be the next step or the evolution of, how they visualize what they're actually doing.
So that means that today, with a 2D images, they have enough information to perform their procedure. I guess they change the angle of the C-arm to get maybe anterior, posterior, and lateral views, or two different views of the same anatomy. Do you think that there is a trend towards intraoperative 3D imaging? Because we've seen that like in spine, with all manufacturers providing the Medtronic the O-arm, Brainlab the Arrow, and Stryker their own system. Um, how much do you see this trend also into extremity surgery?
I think it's coming. I think that the concept has been proven within spine, so it's coming to extremities. Right now, it's just mm, the 2D view, and one thing differently, whether it be the hand or the foot, they can move the extremity. It's a little bit easier, so they can get their lateral, they can get their
Mm,
AP. It's a little bit easier to do it than obviously with spine, which you can't.
yep.
But that as technology comes down the road where they can get 3D and they can see things um, by just having the whatever the machine would be, I think that that's where it's going, because that's where it becomes time intensive, cumbersome, to kind of always be
Mm.
switching the extremity around to where you want to get the view that you want to get. So I think that it's obviously it's coming.
And right now, those kind of procedures they are done in a hospital setting or ambulatory setting. Is it a mix of the two, or what's the size of the hospital that's doing these kind of procedures?
Yeah, so it's the mix of the two. It's in the ASC in the hospital. Typically, with trauma cases that they're addressing, they're in the hospital. But more and more in our U.S. system, they are moving to the ASC as fast as they possibly can.
Okay, so you mentioned at the beginning that you were working for a company that was acquired and that acquired until it went to Stryker. So Stryker right now they have several technologies. They have intraoperative 3D imaging. They have navigation. They have robotics for other business units. Do you think that there is a benefit for this kind of company to apply those technologies to this fast-growing segment? Uh, what's your perspective on these big auto players leveraging their technology platforms for this extremity segment?
Well, let me say it's coming. We know it's coming. I mean, that's why they are making these large investments and buying market share. And we could probably that could be a whole other podcast on what's going on within orthopedics and what's going on because these companies don't organically grow or naturally grow. I shouldn't say all. Some of them do not naturally grow or organically grow. They buy market share. And so in
Mhm.
buying market share, they're also getting these different technologies that come with these companies. And so I totally believe in the future you're going to see in the minimally invasive world or imaging world a move towards a like's going on in spine. Same idea.
All right, and so just one last question about the technology because I'm at the heart I'm a chief technology officer, so I'm very
Sure.
curious about that. Is there a lot of pre-planning on software like templating, or is it more a conventional way to prepare the axis and the angles to be corrected on 2D X-rays?
So there is a lot of pre-planning that will go into a total ankle.
Okay.
That's scans will be sent out, MRI will be scans will be sent, and just to pre-plan, implant sizes and things of that nature to have a plan in place. With other indications, no, not at this point in time. But that's going to change. You can see where this is being talked about and with different companies and why they want to explore this technology. So I believe as we start moving down this path of more of a um, more technology to assist surgeons in getting better outcomes, it's coming.
Yeah, because we could think that with technology you could provide a more patient-specific treatment, because I guess right now they are using different sizes of screws, plates, stuff like that. Is there an opportunity to have patient-tailored implants with this kind of pre-planning or artificial intelligence or whatever the technology could bring to really adjust the treatment to each specific patient?
Absolutely. I think that's where the marketplace is going to be going because of the insane investment in implants that's made by orthopedic companies, the millions and millions of dollars of implants to address a surgical service in a hospital doesn't make sense long term. So I don't, I've posed this question on LinkedIn several times and I get all kinds of different feedback about it, but will there be a day where a patient arrives in the ER, they go through and have x-rays done, scans done, and there's a machine downstairs or sitting there off site where they send the information and the implant is 3D printed and the screws and everything else and it is sterile packed and that afternoon you're able to do the surgery on the patient. I know I'm talking probably 20 years down the road, but I think that's where companies are going to want to go to because it just unbelievable expense of implants,
Mhm.
and having them sitting there, this inventory that doesn't turn, and as costs um, are going to be addressed and want to be reduced, that's the easiest way is just, obviously it's people expense and product expense. And, you know, I think they're going to try and focus on the product first.
Yeah, I mean, I agree. When we developed the Bridget robot for total knee replacement, that was back in 2005. One of the interests from Zimmer at the time was that it could enable to reduce the cost of inventory, because when you have only one instrument that is positioned by the robotic arm instead of all the trays with all the complex mechanical steps and instruments just to place the final 4-in-1 cut guide, then as you say, it's just incredible to see how much is invested to put the instrument trays at the disposition of the surgeon. So I agree with you that there should be a trend towards minimizing this and having something more and more patient specific.
Yeah. Yeah.
Yeah,
I think we'll see it in our lifetime.
yeah, I hope so.
Yeah.
We'll work on that. And
Yes.
all right, so now I want maybe to talk about the choice that you made to be a free sales agent. So when exactly, do you remember when and why you decided to transition from being an employee at Big Ortho and towards being your own boss and develop your own independent distributor model?
Yeah. So I was, it happened quite a few years ago as I was sitting in a meeting with, I always enjoyed, I would, I guess when I was at Smith and Nephew, I would enjoy sitting and talking to the R&D guys and the marketing guys and what was coming and what they were going to be doing. And just, I always enjoyed the new technology that was coming down the road. And I remember sitting in the meeting and people talking about how we were going to, certain product that was going to come to market. And, and the group around said, "Yeah, but you know what? We've been told we're not going to do that because we need to take this product because of just better margins, and we need to pump that. You know, we need to do that." And I just thought to myself, I said, "Man, they're just actively making a decision right now because of, which obviously every company has to do this for profits, but it was driven by ultimately share price." And I just thought to myself, like, that's interesting why that would, are we in this for share price? Or are we in this to help patients? And so that kind of sat with me. And I just, all of a sudden, one day, that day I said, if there's ever a chance for me to do this where I could carry several different technologies and create a group or create a organization that we had all kinds of different cutting edge technologies that we could provide to our surgeons. They could make one phone call to Extremity Surgical, and they could make one phone call to whoever they were going to make the phone call to. Wouldn't surgeons find that to be a breath of fresh air instead of, well, I don't know if they would even find it to be a breath of fresh air at that point. They would just, the Synthes guy would be standing there, or the Striker guy would be standing there, and they used all their products because that's just what they did. And so I just decided that I think that there's a better way to do this. You could provide better service, better technology, and better outcomes for patients and obviously our surgeon customers. And so that's kind of how it started to develop in my mind. And I guess the rest is history.
All right. So today at Extremity Surgical, how many different companies you represent? How many different products that you offer to your customer that is a surgeon, and to have largest uh, possibilities for his procedures?
So it fluctuates depending on one of the things that I found out as, being an independent medical sales device broker is that companies do get bought quite often. So that will change. But at any given time, through myself and partnerships that I have with others, it could be anywhere from 8 to 12 product lines. Um, those are, some of those products are obviously certain technologies that don't get used as often as others. But the one overarching thought process is one phone call to our group allows the surgeon to address anything that they want to address with their patients. And so that's our main focus, our main goal, and it's worked very well.
All right, so I understand all the benefits that you give for your surgeon, for your customers. What are the challenges for that you've faced building this independence in extremity surgery?
Great question. I think what I mentioned just a little while ago is that when you're dealing with smaller companies, their main thought process is they may want to be acquired, and so you then are dealing with companies that are saying to themselves, okay, we're going to be acquired here in 6 to 8 months, so we're going to deal with this in a certain way. So that's challenging, and you lose lines that way. And companies make decisions. They say, hey, we want more focus, more dedicated focus in this market. And if you don't have a representative in that market that is, excuse me, if you don't have one at all, they're going to make a change. So that's not as prevalent as more of them being acquired. But again, you're dealing with a smaller entity. And so that's why, we always want to make sure that we're doing the best we can for both our surgeon customers and those companies we represent.
Okay, thanks. So now moving on to maybe a different aspect of medical sales. We've all experienced the COVID-19 pandemic situation that had, I guess, a huge impact on how medical sales people did their job in the last 2 years. What is the how you see this medical sales job evolving right now and in the future?
I think medical sales overall, a lot of the same tenants are involved, but I think that, during COVID, obviously there wasn't the face to face interactions that we once had. And so I think those that have really embraced different ways of contacting surgeons. And can we pause for 1 second, Lucian? I'm
Yeah.
sorry. I've got to.
So-
I think that during COVID, what really happened that was eye opening is that we had to find out different ways and avenues to connect with surgeon customers. So we became very active on LinkedIn. Um, Utilized a lot of video um, connections. That's how we, typically were able to connect with our surgeon customers. And so it just took on another avenue of communicating with surgeons and others. And as of now, we're knocking on wood. We're almost back to normal in the U.S. I think we will be here pretty soon. And so we've still kept those different things that we were doing. That we adopted. We're still doing those. I think surgeons enjoy them. Some of them do. The fact that they can understand what we do, how we do it, the products that we have, and not involve every single time taking time out of their schedule in their office. So that's kind of what our change has been as we've moved through the pandemic.
and how so this is to how to connect to surgeons to exchange information, and how about the support during the procedure, how, because you could not enter the operating room, how were you able to provide support for I don't know, the most complex cases that usually require a sales rep to be in the room to help with the process and the instruments and all the steps that have to be done in the right way?
Yeah, so that's a great question. So where we are in Florida, we were never banned from the OR. We were always allowed to be in the OR. I do know in some other locations in the U.S. that happened. So I know that there's this movement towards um, case support remotely. which is going to be an interesting thing moving forward, because I think there's a place for that for sure. The issues and problems with remote case support, and I know this is going to cause a fury when I say this, is the minute something breaks or the minute that something goes wrong in those scenarios, that's going to be the end of remote case support. And I know there are companies that are very vested in it, and they're investing millions of dollars in order to bring this capability to the operating room. But I've seen it time and time again. And once there's some kind of glitch or human error that on the other end, or something goes down or something to that effect, they immediately are going to ask, "Where's our sales representative? We need it. They need to be here for this," and that will be the end of it. So if they can perfect that, I think there's obviously a place for it. I know there's lots of companies out there trying to perfect it. So we'll see. I guess it'll be a wait and see. How about that?
Okay. Let's wait and see. Myself, I do believe there are some use cases for remote case support, and also it's an excellent opportunity for the company to to learn and to teach their employees, being either engineering or servicing, because otherwise it's only a one people to one people interaction, and with this kind of tools you can leverage one to many interaction. So, but I understand I hear your point that when something goes wrong, then you will have to figure out how the technology can answer those issues while you don't have anybody that is on site.
Right.
Okay,
Yeah,
thanks. So
exactly.
yeah, so it also, I mean, about the training, it also shifts the way that surgeons are trained or medical sales reps are trained. And I know you have something going on with Matthew Redcott around digital training, building a platform that would be called Medical Sales RX. Could you talk a little bit more about this project, why you do this, and maybe when you will release it?
Sure. Yeah. So it's exciting times. Myself and Matthew Ray Scott. If you're on LinkedIn, make sure to connect with him. He is a branding expert within the medical device space and specialty surgeon space. And so he and I have known each other for several years. We worked together in Smith and Nephew quite a few years ago. We don't want to date ourselves with what year that was, but it was let's just say it was uh, pre iPhone whatever. But anyway, so we were together, and we've been working on some different projects. And I just one day I said to him, I said, the pandemic has changed a lot of the ways that people consume information, the way they learn. The days of let's get everybody to go to uh, a city and sit in a classroom and learn, which there's a place for that, and we should still do that. I'm not saying that at all.
Yep.
But then we just said, hey, one day we brainstormed. We said, okay, we're going to come up with Medical Sales RX, and medicalsalesrx.com is going to be the premier online platform for medical device salespeople. They can go out there, and again, I don't want to say this to sound like a commercial, because I don't want it to be that, but it's exciting because it's going to be a place for people who want to get into medical device sales, are already in medical device sales. They want to learn about different segments within it, whether it be spine, cardiology. We're going to have course content creators that are going to come into our platform, provide courses. And these are people who have done it before. These are VP of sales. These are people who are CEOs at companies, and they've excelled in this area, and they have mentored and coached thousands and thousands of representatives to be successful. So when it's all said and done, when you look at, when the overall marketplace, there wasn't anybody who was providing that kind of opportunity for people to come in and do that online. So they can do it on their time, when they want, do it anywhere on their time at any place. So that's kind of
Mhm.
the the thought process behind Medical Sales RX.
All right. So when can we expect to see this platform up and running?
Um, I would envision here holding me this too as we work diligently on this. We are hoping in March that that's going to come to fruition. Um, we'll see. It's
Okay.
March is the goal. How about that? So hopefully we'll be having a, a launch announcement for that.
Cool, cool.
Yeah.
So let's wait and see as for the emergence of new assistive technology in the extremity surgery space. So
Yes.
thank you, Eric. So as I've done for the past two episodes, I will give you the opportunity to ask me a question that I will answer right away.
Great. Well, my question is this: as the CTO or Chief Technology Officer of a innovative company, where do you see the marketplace going as it relates to robotics and technology? Do you see this being used in the majority of cases moving forward, or where do you see the marketplace?
Yeah, that's a good question. I think we are just at the beginning of the introduction of robotics in various fields, like in my space, which is interventional oncology and percutaneous ablation. There is almost no robotics cases, so there are still some segments in surgery that have to experience the benefit of robotics, and I would say beyond any kind of computer assisted technology. It can be navigation, it can be augmented reality, it can be pre-planning and post-confirmation software. And so the second point is, I think for quite some time robotics was intuitive surgical, the Da Vinci platform,
Mm-hmm.
and now we see that robotics is just is becoming a component of an ecosystem, and this is a core component because it provides the guidance, the manipulation, and even the telemanipulation. But to really provide benefits, it has to be combined with additional components that will be image processing, that will be some kind of visualization, some kind of data processing to give insights on what happened before, during, and after the procedures. So maybe there are some cases where robotics is not exactly what is the best technology to improve the patient outcomes, and maybe that's the rest of the ecosystem that will be the most impactful for this kind of procedures. So I see the marketplace going towards a more an ecosystem of technologies where robotics might be at the center or not, and that this ecosystem should be leveraged to all the other fields of surgery where there is currently no robotics. So, like in extremity surgery, maybe it's not a big robot that is expected from surgeons to help them better do their procedures, and maybe it's more some kind of wearables that leverage the information from pre-planning and using some sensors to just find out where the instruments are relative to a 3D image that could be acquired during the procedure. So it's not robotics per se, and maybe there is a small robotic component, but I think we will see more nuances into what we call a surgical robotics in the future, and that's already what we see today in the 150 surgical robots that are on the market, and there is a great variety of how robotic is implemented for this kind of product. Does
Interesting. Well,
that does that answer your question?
it does. Yes, yes, yes. It's an exciting space. I mean, when everybody says robotics, they think, "Wow, this is you know, it's it's a very interesting." I guess, and we'll see how it as we move forward. It seems that the robotics adoption is happening in our marketplace all over the place.
Yeah, yeah, definitely. I mean, there has been a strong adoption in. I mean, relative to the market, it's not that big, but in laparoscopic surgery, in orthopedics, neurosurgery, spine, and there are many other places where robotics can provide benefit for the surgeon and for the patient. So we'll see, and it's going to be the job of small startups and big companies to invent what will be the right technology for the right procedure for a patient specific treatment, hopefully.
Well, that's great. Well, I look forward to what occurs in the future. It should be exciting.
Yeah. So thank you very much, Eric. We are at the end of this episode of the Less Invasive Podcast. I'm really happy that we took some time to explain and learn about extremity surgery, which is, I must confess, an area of surgery that I didn't know much. So now I'm a little bit more knowledgeable in that field, and I have some ideas where to search for. And I see that there are opportunities for companies, new technologies to enter this market and to provide products or services that would benefit the customer, the surgeons, and the patient. And I'm eager to learn when the Medical Sales Eric's online platform will be launched. Thank you very much, Eric, for this for being there.
Thank you, Lucien. Appreciate you having me on today.